Now here to answer some of your questions is dermatologist Howard Sobel and psychotherapist Robbie Ludwig. Robbie is also, by the way, the host of TLC Channel's upcoming series, 1 Week to Save Your Marriage. Good morning to both of you.
Good morning.
Yeah.
Good morning.
You know, we've got a lot of emails, but we had 3 top questions. Let's hit the first one. Lori from Washington embodies this question. She writes, I am 35 and I have recently noticed large freckles and some irregular pigmentation on my face. I've also noticed extra skin around my cheeks and jawline, creases on my forehead, and lines around my lips. Sound familiar, people?
Sure.
I know I'm pretty young, but what is recommended for reducing the signs of aging? I think probably, Doctor, we should start with you here.
Okay. I mean, most of Lori's skin changes are just part of the natural aging process. As we get older, we've all been in the sun, increased sun exposure, cumulative effects of the sun will cause hyperpigmentation of the skin, it'll cause increase in freckling, and also excess skin. As we get older, we lose the elasticity in the skin.
Sure, so what do we do about it?
What do we do about it? Okay, we're born again. No. What we can do is, we've got to avoid the sun. We need to put a sunblock on way before we go out into the sun, at least a half hour before,
right.
And apply it during the daytime as well. Okay, but there are many different procedures we could do. Okay, there are fillers where we could fill and put back some of the volume that's lost, such as Restylane or fat to fill up the excess skin. Where there are lasers that can get rid of the excess pigmentation and the freckles, and there's very simple procedures. They take a couple of minutes in an office over a period of a couple of months with no downtime. That's key. They're called intense pulse light lasers. And then to get rid of the little wrinkle lines, the little creases over the forehead or around the mouth, we can use Botox. Botox decreases contraction of muscles.
Maybe to some degree you can pick and choose, because you sort of listed a number of things, and I think maybe you could pick and choose the thing that you really want to change. Maybe you can't change everything. Robbie, I know that there's a lot of emotional toll on women and men as they age. What would you want to say to Lori from Washington?
Well, you know, she should certainly explore whatever she thinks will make her feel happy and feel better. But there are other ways that you can really, non-surgical ways that you can make yourself feel better that are easy. Change your hair, change your makeup, go get a stylist and get a complete makeover. Make sure that you're healthy in the other areas of your life, exercise and diet.
And you also say embrace your mature sense of beauty.
I think we need to start embracing a mature sense of beauty, that it exists, and we need to start telling ourselves that, so that we're not competing with a 20-year-old version of ourselves. We're not supposed to look 20 the rest of our lives.
Okay, email number 2. It comes from Terry, who asks, I'm a 45-year-old woman who is in fairly good shape. I work out 3 to 4 times a week, but can't seem to get rid of my belly. I had liposuction 2 years ago, and it didn't make any change. Would a mini tuck be an option? This is a very common question.
Yes, well, it's very important. People have to understand that liposuction is for someone that has good health, good nutritional program, exercises regularly, and if they have on their abdomen more than an inch to pinch, and they have good tissue elasticity, then liposuction, the local anesthesia, is for them. But if the skin is excessive and it hangs over their belly...
Babies also they have excessive skin. So you're talking about a tummy tuck.
A tummy tuck if you have excessive skin, but also sometimes a tummy tuck and liposuction together if you have both.
Can you tell women to embrace their tummies with our mature sense of our tummies?
I could tell them, but they might not listen to me. But, you know, I think it's important. If you are intelligent about it and don't think that there's a magic fountain of youth, then I say do your research, make sure that you're choosing a doctor who's board certified, and go for it. I think, you know, we're always trying to rediscover our beauty at every stage, and sometimes we need to go to extreme measures.
Somebody's also said to me, you know, it's a medal of having had babies, so embrace that. It's a medal
it's a medal, and don't buy a bikini.
I know. I don't know if we have time for a third question. We really don't have time for a third question. We'll have to bring you back. Thanks so much.
Okay, thank you.
It was such a pleasure, Doctor. Thanks, Robbie.